Is COVID-19 Gone? Read to you by Carol Brigham. On May 5, the World Health Organization, WHO, said COVID-19 is not a global health emergency anymore. On May 11, the U.S. Department of Health and Human Services, HHS, said the public health emergency in the U.S. was over. But COVID-19 is still making some people sick. Both the WHO and HHS said that fewer people are getting COVID-19. Reports show that the virus is not as strong as before. Fewer people are going to the hospital with COVID, and fewer people are dying from it. They said more people are protected from the virus because of natural immunity, vaccinations, and medicine that can treat the virus. They said COVID-19 is not gone, but the health emergency is over. What changes now? The U.S. government declared COVID-19 a public health emergency on January 31, 2020. Because of this declaration, the government could create laws and programs to protect people from the virus. Some of these programs have already ended. Other programs are still going on. Now, those programs will end too. Tests and vaccines. COVID tests, vaccines, and treatments have been free to all people living in the U.S. The government paid for them. Now the tests, vaccines, and treatments will not be free. Insurance should pay for them, but you may have to pay part of the bill. People who do not have insurance may still be able to get tests and vaccines for free from community resources. The government also sent free at-home COVID tests to anyone who asked for them. This program is ending. If you want at-home tests, you will have to buy them yourself. Insurance may not pay for at-home tests. Medicaid. During the pandemic, the U.S. government wanted people to have insurance. They sent state governments money to help increase Medicaid programs. People could stay on Medicaid as long as the pandemic was going on. It did not matter if these people met the requirements for Medicaid. Starting April 1, 2023, states could start removing people from Medicaid if they did not meet the requirements. Some states have already started doing this. Each state will decide how people can renew their Medicaid application. If people do not complete this process, they may lose insurance. Experts say up to 17 million people may lose health insurance. Tracking the virus. The Centers for Disease Control and Prevention, CDC, collected a lot of information about the coronavirus. They tracked how many cases were in each state across the U.S. They tracked how many people tested positive and negative for the coronavirus. They tracked how many people went to the hospital and how many people died. During the public health emergency, states and labs that did the testing had to send their information to the CDC weekly. They had to give the CDC as much information as they could. The CDC used this information to tell people where and how fast the virus was spreading. States and labs do not have to send this information to the CDC anymore. The CDC will use other ways to track the virus. Hospitals must still send their COVID-19 information to the CDC until the end of April 2024. The CDC will use this information to track the virus. They will also track the virus like they track the flu each year. They will report how the virus is spreading and how many people are dying from it. Living with the virus. Scientists say that the virus is not going away. People will still need to protect themselves from getting sick like any other virus. They say you should still wash your hands often and stay home when you are sick. Most places have stopped asking people to wear masks. Some doctors' offices and hospitals have also stopped making people wear masks. Most doctors and hospitals still want people with respiratory illnesses to wear masks. Some people are still wearing masks in stores and around big crowds of people. It makes them feel more protected. Officials from the Food and Drug Administration, FDA, are meeting June 15 to talk about new COVID-19 vaccines. They will decide what updates the vaccines need. They will also talk about who needs to get new vaccines and how often they need to get them. People who are 65 and older or have problems with their immune system may get COVID-19 more easily. They are also more likely to die from the virus. People with other health problems and disabilities may also get the virus more easily. It is always important to check with your doctor about your health. Your doctor can help you decide the best ways for you to protect yourself from any virus. For more information about Easy English News, or to subscribe to our digital or paper copies, visit our website, easyenglishnews.com.